Good morning, good morning, good morning. Time check, it is 6 minutes after 10. Thank God it's Friday. It's the first Friday in the month of February, the month of love. For those of Dr. Abiola, what are you doing? Are you prepared? Oh, it's the first Friday in the month of love, and by next week we'll be in the thick of things with regards all things love. I'm sure we'll be seeing billboards and all of that. Sha, we are here for you over here at Radio Doctor to make sure that you don't do what you're not supposed to do, and you don't come back on Monday and you say, "Oh, what happened was we don't want to know." Okay, you're tuning to Women Radio 94.7, the voice of women, Nigeria's first and only radio station for women and their families. This is Radio Doctor, your free health consultation program where real doctors advise real people on live radio. And this is Nigeria's first specialized health program on radio where we get medical doctors to consult for free on radio and to advise for free on Women Radio. My name is Fumi Bangbala, and our doctor today is the Good Doctor. There is a series like that, yes. The Good Doctor.
Yes, there is.
Dr. Abiola Ajayi, the MD CEO of ROA Specialist Hospital. Good morning, Dr. Abiola. How are you this morning?
Good morning. I'm doing very well. Just check my blood pressure. It's normal.
It's normal. Why would your blood pressure not be normal?
For once.
Wait, is your blood pressure is always high?
No, I used to have, like a few years ago, I used to have a problem with blood pressure, always high. Even while using my medication, it was always high.
Oh, wow.
So change my diet, learn to meditate.
Oh, wow. Okay. That's interesting. Okay. Happy New Month, because the last time we saw each other was all the way last month.
All the way.
All the way last month. And today we're going to be talking about something interesting, understanding hypertension and lifestyle risk factors. Before we go ahead, we are live on YouTube at WFM 917. And you can listen to us on the go via our website, www.wfm917.com. The phone lines, I want to say the phone lines will be open, but me and you know that you're not going to call because you are hiding. But one day we'll break that jinx, we'll break that stigma and stop hiding our issues on live radio. So yeah, to set the foundation, Dr. Abiola, what exactly is hypertension and why is it often called a silent killer? I mean, if you've been listening to us on Radio Doctor, you know this question, you know the answer to this question, but let's go.
Yeah, so hypertension, we also call high blood pressure, same thing. It just means that your blood pressure is persistently elevated in your arteries. So, when we say blood pressure, that's what forces blood through your vessels to all parts of your body. And you have to have some degree of pressure so that the blood will move. It's just, think about the heart and your blood like a pump and water. You need to have some pressure so that the water will come out of your tap or come out of your shower head. So we need the same thing. We need a little pressure, but just using the same analogy, if we put a pressure pump and increase the pressure, we now have the risk of blowing out pipes, and we call pipes the same thing as blood vessels, so we have problems with that. If they have persistently elevated high blood pressure, we call that hypertension. And why it's called a silent killer is that most people feel absolutely normal when they're already in the danger zone. And I'll use an example. Two of my cousins, my first cousins, just popped in to visit me last Friday. And I was seeing patients. My PA came and said, "Oh, your cousin is here." I won't mention their names because they may be watching. And I said, "Oh, they come in the office. What's up?" Like, no. We just want to see you. Happy New Year. No problem. We're G-staying. And then I'm like, "Hey, I got to get back to seeing patients." And right before I let them go, I said, "Hey, call my nurse. Will you check their blood pressure and let them just do some basic tests?" One of my cousins, her BP was 190 over 130. And she had been talking to me, 190 over 130, as we'll get into these numbers later, is absolutely dangerous. You should not allow that person to leave the hospital without controlling that. You're at risk for sudden death, imminent. It's It's just not when, but it's not will you have it, but when would you have it? And she had been talking. She wasn't complaining about headaches. Wasn't complaining about chest pain. Wasn't complaining about anything. So that's what we mean by silent. And had she not had intervention that day, she could have possibly died. Her risk of having a heart attack or a stroke, well, yeah, her risk of having a heart attack or stroke were at that time times 3. So it's called a silent killer because usually there's no pain, there's no warning, there's no early symptoms. It's sudden, usually sudden. What happens within minutes, your life has changed.
What is the normal? What should the numbers be for a healthy person?
Yeah, it keeps changing. Every year they have a conference, usually in the UK, where they talk about high blood pressure.
Okay.
And the most recent one, it's 110, the top number over 70. That's what the target is.
110 over 70.
Over 70. I have to say that because that's what's in the literature now, but I don't subscribe to that.
Okay.
Because at times it's hard to get some people's blood pressure that low.
Right.
I first did the experiment with myself. I was like, okay, I'm going to get my BP to that target, to that 110, 70 with different medications. And every time it got close to 110, I just started feeling nauseous and sick and not feeling myself. And when I now went back to the previous guidelines, 120 over 80, I now felt better. So, and that's been backed up by other research articles too. So I believe that the pharmaceutical companies wanted to sell more drugs, so they pushed for that lower thing. But I try and do 120 to 130, the top number, and then 70 to 90 on the bottom number. Those are excellent targets to try to achieve.
Right. So at what point does blood pressure then become hypertension? Is it at that one? No. Because when you said your cousin had the 190 over 7?
120.
Over 190 over 120. Was that high blood pressure into hypertension? Is she hypertensive?
Yeah, so yes, she is. And she's one of those 50% of Nigerians that have high blood pressure that don't do anything about it. Right? So 50% of those that have high blood pressure don't even know that they have high blood pressure. And then the other half of those people don't do anything about it, or they're not doing the proper thing about it.
So hypertension, obviously blood pressure is what leads to hypertension. A high blood pressure.
High blood pressure leads to
hypertension. And then if you don't do anything about it.
Yeah, if you don't do anything about it now, you're at risk for so many different diseases. You're at sudden risk for sudden things like heart attack and stroke, and long-term things like heart disease, kidney failure, kidney disease, all of those things. Even blindness can be affected by.
Wow. So it's one thing that has different branches, a tree that has different branches, basically. Yes, right. Exactly. And the I think for me, because I've been seeing quite a few young people have a heart attack, or maybe they die because they left their blood pressure unchecked. But I think that a lot of us young people think that it's an old person's disease. How often should young people check? Because we live in Lagos. Let's call it for what it is. Or we live in Nigeria. And Nigeria by itself, I think if your blood pressure is supposed to be 110, 120 over 70, 80, already the fact that you live in Nigeria, let's just leave it as 140. Because that's like, we have to be factual and realize what it is, because the society or the country that we live in is already at an all-time high, whether through noise or whether via stress, whether insecurity. You don't even have food. There are people that don't have food. What else again? That are already panicking. Oh my God, what are my children going to eat? So that's already become part and parcel of who we are. But how often should, is that the question to ask? How can we get young people to take their health more seriously, to take their blood pressure more seriously, to make sure that they're checking for it, so that we can reduce the amount of people that we've seen, young people we've seen who have died from this disease?
Yeah, I hope it's through education and shows like this and other things that young people will understand this is not a disease of older individuals. That was true maybe 30 years ago, but nowadays a lot of stuff has changed. 1.3 billion with a B in the world have high blood pressure. So this is an extremely common problem. It takes about 11 million people. It takes the life of 11 million people a year. So everyone should pay attention to it. Under the age of 35, 20% of Nigerians have high blood pressure. 20%. So one in every five have high blood pressure. It's if you don't have it, I bet you somebody that does. You know, in the past, people used to eat fresh food. They used to have less stress. They used to do more walking, more activity. And today, you know, young people, we have young bankers, we have young tech workers, we have people that have desk jobs, have traffic stress, especially in Nigeria and Lagos. And you're eating fast food. People are drinking sugary drinks, minerals, just grabbing those, and they do very little exercise in the day. So that's why we're seeing people in their 20s and 30s. I have patients that are in their 20s with severe high blood pressure. You know, BP 150 over 100 and more than that. So there was a study that looked at Nigerian university students, and it showed that at least 1 in every 5 or 20% of them already were hypertensive. So this is something that affects every age group, and it's increasing in the younger population. So next year there'll be more percentage. The year after that, it will continue on the same trend.
Good, Abek. I have a blood pressure machine. The last time I used it was when I was pregnant. No. Yeah, when I was pregnant, and I think
does it have batteries in it?
I think, yeah, they should. I think so. Yeah, I was when I was pregnant. And so the last time I used it when I was pregnant, and I think it was the same year Nigeria was playing South Africa, the AFCON. So that was the first time I'd used it. I'm always just like, oh, but I need to. It's literally on the TV, and I see it every day. It's on the TV, console. Yeah. I'm going to do it. Let's do it together. Let's do it. But let's talk about salt. See, every time I use salt, I panic because I think we had a salt conversation a while back. And so I'm like, I think I'm using too much. But I also recall that the older people get, they reduce their intake in salt. I also know that I've heard people say that salt is a big hypertension starter or killer. I don't know.
Right.
So is salt the only problem, or are there other risks, hidden dietary risks that a lot of us, let me put myself in that same category, are there other hidden risks that dietary wise that we overlook?
Yeah, so I can't say salt doesn't matter. Salt matters.
Okay.
But it's not a lot of people, especially older people, when I tell them they're hypertensive or they have high blood pressure, the first thing they'll say, but I don't eat any salt. It's not a direct correlation. And in fact, there are a lot of other things that are higher on the list of causing high blood pressure than salt. You know,
okay.
If your kidneys are working well, your kidneys can control your salt levels in your blood. That's part of the main job of your kidneys. But when you have some hidden enemies, I'll call them, like sugar, and sugar comes in many forms. It's not just the white sugar that you put in your tea or coffee. There's sugar in bread, nowadays they put sugar in almost everything, and they have so many different names for it. Maltodextrin, sucrose, lactose, so many different names for sugar, and they're sometimes hidden. The sugar, refined carbs, vegetable oils, which is the corn oils, rapeseed oil, soybean oil, all of those compressed oils, alcohol, and processed foods all contribute far more than salt to high blood pressure. So you'll always hear me talk about the dangers of too much sugar and too many carbs in your diet. And since we've been
I'm laughing. I'm laughing.
Because I'm talking about you.
Yes. No, but wait. But hold on, Dr. Abiola. Hold on. I started eating clean. I'm not even gonna lie. From the 1st of February. Yes, and today is the 6th day, and I'm doing well. So I know that this is not what. But yeah, it's probably what we're talking about. On Sunday, I have a timetable. On Sunday, so I haven't had any junk, which is weird. I've not had egg roll in 6 days. Please check on me. I'm not doing well. I've not had puff puff in 6 days. Again, check on me. I'm not doing well. So what I've been having, like on I can run you through. On Sunday, I had a cup of rice with 2 bananas and avocado because I was too tired from church to cut some vegetables. By Monday after work, I had vegetable soup with the best oil and goat meat because I think goat meat is healthy. Yes. What did I have that way? I had it with boiled plantains, right? And then in the evening, I think I had no, I didn't have anything in the evening. I don't remember what I had on Monday evening. On Tuesday, I had carrots, green peppers, quite a few vegetables, and I had them again with boiled plantain. By Wednesday, that's Tuesday. By Wednesday, I don't remember what I had. Wednesday, I had salad with a cup of rice and avocado and boiled eggs. Yeah. Yesterday, what did I have? I had oats in the morning with honey and avocado and boiled eggs. And then by afternoon, I had a cup of beans and vegetables. So,
Okay.
No,
You made some
yesterday,
changes.
yeah.
I didn't hear bread come up once.
Dr. Abiola, even the rice is gone, Steph, because I think I had rice twice this week. I didn't even want to eat the rice second time, but because I hadn't meal prepped, because that's the issue, because you don't meal prep, you don't have it, you eat anything, but I haven't had bread. Yeah. And bread, I know that bread is my own silent killer. And then, what else did I do? Okay, so I made rice. I made asun rice last night for the family, and I was like, I gotta taste this thing. So I had a little bit of it yesterday night. I shouldn't have, but I had a little bit. It was so, Dr. Abiola, it was so good. Even me, I was like, I should open a restaurant now. So yeah. So I'm doing because I have a timetable. I've gotten my yogurt. I need to get my granola maybe today. So I'm trying to be on the straight and narrow. I saw what I weighed last week, and I've dropped 2 kg. So.
Yeah. See, 2 kg in a week is excellent.
I think it's the water weight, really, though. Yeah, because I think I lose the water weight first easily, and I know my problem areas, and I can see differences in my belly. Because I saw my belly one time, I was like, "Wow, you are a grubby dough. You are covetous. You are greedy. You are a glutton." So I'm seeing differences, and I'm happy. So yeah. Anyway. So we're talking about carbs and how it is. So and that's leading to my next question, because a lot of us
high sugar. So a high sugar intake. People that drink minerals and increases your risk of high blood pressure by 30%.
By 30.
If you now add processed foods to that, it increases your risk by 40%. Processed foods are things like there's this treat that I see sold in traffic that's about this long.
But that's rubbish, though. It's so terrible.
Yeah. And then if somebody really wants to understand the process, just look at the ingredients. When you see more than 4 ingredients or long names, more than likely it's processed or ultra processed. And all those things can lead to high blood pressure. I think off air, I mentioned how probably about 5 years ago, I used to struggle with my blood pressure. It was using 4 different medications, close to the maximum dosage. And some days my blood pressure would still be out of control. I was even having chest pain and all of that. When I committed myself to studying this integrative medicine, which I always talk about, which is nutrition and get into the root cause of it, and I changed my diet, my blood pressure just went down. I now use 1 medication maybe every other day, as opposed to 4 medications, sometimes twice a day. It's a night and day difference. I don't have chest pain. I don't have any of those palpitations that I used to have. It's a night and day difference. It's so much of a difference. I don't want to go back, to how it was.
Yeah.
And I wish I could distill that into everybody.
Yeah. I'm still speaking on hypertension. A lot of people, because diet plays a huge role, or lifestyle changes, lifestyle factors play a huge role. But then Nigerians believe that our food, like when you say, oh, lifestyle changes, and you talk about food, immediately their minds are thinking broccoli and things like that. But don't we have Nigerian foods that are healthy enough? And even cooking, or you believe that if the oil is not floating to the top, then the food is not there yet. Can you speak to that and how that so it's two things. We have healthy Nigerian food, so you don't have to go and say you want to buy broccoli and the expensive ones. But then what about cooking the Nigerian foods in the Nigerian way as well, and how it contributes to hypertension?
So and I have a group on social media. We'll give my handles later, and I have a WhatsApp group for patients where I hear that a lot. They'd say, Dr. Day, you're telling me to eat this healthy, but we don't have that kind of food in Nigeria. I have family members that told me that. So, and of course, I didn't believe them because I know how I eat. So I'll now make the meals and put the recipes and the pictures on the page. And everybody's, wow, what? And I said, I bought all these things I bought all the ingredients right next to me here. So no, you don't have an excuse. It's one of the things that we do as Nigerians, we like to fry everything. Right, and we like to fry it in.
Well, fried food is good now.
It is tasty, right? It's very tasty. Your body likes it. Your tongue likes it, but it's probably one of the most unhealthy things that we do. I've talked about the seed oil, so that's canola oil, Aurora, all those kind of oils are not healthy. Your body does not like them. Over time, as you're eating them, you build up something called linoleic acid in your body, which leads to weight gain, hypertension, and so many other chronic diseases. In fact, our coconut oil is my favorite, one of my favorites. So I use butter, coconut oil. I don't like the taste of palm oil, but I include palm oil in that because it's healthier. So, these are less processed oils. These are oils that we're meant to eat. Yeah, there shouldn't be an inch of oil on top of everything, but if you have to use it, use one of the tropical oils, coconut oil, palm oil, or butter. It's far healthier than using the seed oils. One of the best things you can do is don't fry everything. You mentioned 3 or 4 times that you have boiled plantain.
Boiled plantain, yeah.
Yes, so we can boil things. Air frying. I have an air fryer, and I love that. And air frying can give you that same crunch.
Okay.
That same crunch. Oh yeah, it gives you that same crunch that you get from something that's been deep fried, but you don't have to ingest all that oil. If I'm air frying something, I'll just lightly cover it with coconut oil or butter. Air fry it. If I air fry my chicken, my skin will still be crispy, and it's far more healthy than dropping it in a vat of canola oil. So, and we have a lot of vegetables. We have a lot of soups that are vegetable based. So we have healthy options. It's just that we don't always lean towards.
All right. Okay. I think one more question before we switch gears.
Sure.
What's the link between hypertension and obesity, body weight? Like, what's the link between it? Especially in a city like ours where people do not like to walk, right? You want to go down the street and you're like, oh, you wave down a bike. I remember before I started driving to work, I couldn't, because I didn't know my way around. So I think the first time, maybe the first 2 times, I took a bike from where Women Radio is to the gate. And the first time it happened, I was like, hold on a minute, did I miscalculate? Or was it shorter than I thought? So afterwards, before I started driving to work, I just started walking. But you would see people who are in front of, it's like a 10, 15-minute walk. And you see people that would rather take a bike from there to there, right? Or you want to go to the bus stop, the next bus stop, which is less than 5 minutes away, you take a bike, right? This is not that, oh, you're too tired to walk. It's just that you do not walk. So what's the link between it? Because we cannot lie. We have a lot of overweight people in Nigeria due to the kinds of foods that we eat or how we even prepare those foods. So what's the link to hypertension, and how does physical activity come into play there?
It's a direct link. you know, some places we say that a sedentary lifestyle, meaning sitting all the time, or physical inactivity, is the new smoking. So the same risks that we used to get, like you don't see a lot of people smoking cigarettes nowadays. It's fallen out of favor. We know that's unhealthy.
Actually, you're correct. Huh.
Right?
Interesting. Yeah, people
You see
drink
it
more
all
than
the
they
time.
smoke. Yeah, they drink more than they smoke now. Why is that?
It's the perception that there's nothing healthy about smoking. Right? The public message has gotten through to most people that smoking is just it's directly linked with cancer. And it's not just lung cancer, many different types of cancer, and it's completely unhealthy. So a lot of people won't pick it up. But nowadays, before, people that were stressed would smoke. You'd see bankers. When I was in medical school, half of the medical students smoked. Everybody was stressed with smoke. Now, when you're stressed, instead of smoking, you eat, and you sit down and eat, or you're sedentary, and you now get some of the same risk factors because your heart is a muscle. If you don't use it, it will weaken. And physical inactivity can lead to poor circulation, weight gain, makes your arteries stiff, and your blood pressure will definitely rise. So there's some research that says just 30 minutes a day of some kind of activity, whether it's brisk walking or weight training or something, can reduce your risk of heart attack or stroke by 30%.
Right.
You can drop your blood pressure by 10. So if your normal resting blood pressure is 150 over 80, just that little bit of exercise without medication can drop it from 150 to 140. Anytime your blood pressure goes up by 20, it's a double the risk of stroke or heart attack. So if I go from 110, or if I go from 130 BP to 150, I have double my risk of having a heart attack or a stroke sometime in my life. I can reduce that risk by doing a little activity, 30 minutes of brisk walking, 20 minutes of weight training, something like that, just moving. Even, you mentioned it, even like now I go to a place where I have stairs in an elevator, I'll usually offer the stairs just to put a little bit of, just give me some more steps and put some more exercise in. So, and those kind of things make a difference, taking a bike when it's a 10-minute walk could really cost you a chance to lengthen your life or extend your life.
Okay.
Movement
for someone
is free. It's free medicine. Free medicine. Exercise and movement is free medicine.
Actually, yes. I find that whenever I take my walk, so this week what I did was I mixed it up. I really like to walk. I see running, that huffing and puffing. I like running after it is done. I don't like the process of running. Plus, I think more so because you can achieve more. Is it half of what you do by walking in less time? Does that make sense? Yeah. So if I do a 5-kilometer walk, it's about an hour, 30 minutes. But if I do a 5-kilometer run, it's about 30, 45 minutes. So I like the dividends of it, and then you feel it in your body. But I'm just like, please. So I'd rather walk than just hopping and puffing, and you're just feeling so much pain. It's okay. It's okay for me. But this week I decided to mix it up with cardio, which I hate. But for some reason this week I was like, okay. But one thing I find at the end of it is I feel better. I feel very upbeat. I feel like, oh yeah, let me take on the day, as opposed to when you wake up groggy or at night. I never used to understand why people say if you have dinner, go for a walk, you feel better. But I find that when I eat dinner, maybe I eat a heavy meal and I take a walk, I feel lighter and better. So yes, I'm calling on. See, I say let's start February challenge. People do not answer me. Let's start walking. Answer me. I don't. What else am I gonna do for you? I'm trying my best. Okay, first let's move over to people who have already been diagnosed with hypertension. Is it possible to control it, or it is mild, or is it a case of you can only manage it? Can it be reversed at all? Just by
just by lifestyle changes.
Yeah.
And I get this question a lot, especially for newly diagnosed hypertensive. In I'll call it in minority of cases, yes. So if you catch it early and you now address the lifestyle factors that are contributing to it, yeah, you can sometimes reverse high blood pressure. But in our environment in 2026, I would say that's probably about 10% of cases. 90% of people, you're just going to end up managing it lifetime.
Mm-hmm.
And a lot of people hate when I say that, but it's the truth. It's you if you manage it. If, for example, now they have combination blood pressure pills, so you may just take one pill a day. It takes you literally seconds to do that, and it can make sure that you live to 90 or 100, whatever genetically you were supposed to live to. So I tell people, don't worry that you have to take medication maybe for the rest of your life. If you decide to improve your diet and exercise, if you decide to improve your diet and exercise enough, then I will know because your BP will be dropping very low. So when you come to visit each time, if your BP is low, I'll start reducing medication. But
Right.
like I said, that's very, very, very rare.
Right.
Not something we see often.
So what I'm
We
hearing
can
you
control our
say,
lifestyle that well.
what I'm hearing you say is that when a person already has been diagnosed with hypertension, you give them meds first before they now start changing. So it can be lifestyle changes before the meds.
Oh, okay, no, okay, now that's a good way. So no, it depends on what the degree of high blood pressure they had. So if I see somebody that's BP is 145 over 95, a younger person, maybe 40 something, I will preach lifestyle, diet, nutrition. I'll even create a guide for them, what to eat, what to avoid, how to exercise. I'll create like a 3-page PDF and send it to them. And those people can do very well. If I see somebody for the first time and their BP is 190 over 120, that's beyond lifestyle. And because they're already in there, anybody 160 or above, it's pretty much outside of, hey, just diet and exercise are going to control this. I need to get that person on medication, especially because their risk of stroke and heart attack jumps when the blood pressure gets to that level. But yeah, there are some people that if you catch it early enough, you can reverse those high blood pressure changes with just lifestyle and diet.
Okay.
It's possible.
So even with the person with the 190 over 120, it has to be meds and lifestyle.
Yes, that person's getting IV intravenous medications. You're going to hold them down, give intravenous medications. Yeah, because it's. I tried. I even used my cousin. I said that came to visit me. When I saw her BP was so high, I gave her a combination blood pressure drug, a tablet, 3 drugs inside a tablet. And I said, let's check your blood pressure again after an hour. When I checked it after an hour, it was higher.
I'm sorry?
Yes, it was higher.
Why?
It was higher. Well, partially because now that she saw her blood pressure number, she was more stressed, and she's still in the hospital at that time, and I think that stress causes. So somebody like that, give intravenous medication until you bring the blood pressure down, and then try and maintain that with tablets.
Oh, interesting.
It's important to note.
Go ahead, please.
Oh, sorry. It's important to note that even if you can't cure your high blood pressure, you can improve it through lifestyle. So I don't want to think that, you just take medication and forget it, right? Like I use myself, I used to take four drugs, now I only use 1 because I changed my lifestyle, right? So that's still, we can't underestimate the power of diet, nutrition, and exercise. Is really important.
Very important. Thank you so much, Dr. Abiola. What are the long-term complications of uncontrolled hypertension to avoid a tragic situation, basically?
What are some of the long-term effects?
Mm-hmm.
So if you live long enough, meaning your blood pressure is not high enough that you have a stroke or a heart attack that kills you, you can have heart disease where we have something called hypertensive heart disease, where your heart gets larger and larger because of all the pressure. And you have that in a large heart. And a large heart does not work better. A large heart works worse. It pumps less blood for each beat, carries less oxygen, and at times you can go into heart failure from high blood pressure. Heart failure meaning the heart is barely pumping, your water is starting to accumulate, so your legs are swelling, those kinds of people. And you can get to a stage where it's irreversible. So by the time you get into true heart failure, it's hard to turn back from that. And then you're on, most of my heart failure patients have anywhere from 5 to 10 medications that they use just to manage the BP.
That's for heart failure. And there are certain things that they can't do anymore.
Yeah, there's a lot of things they won't be able to do anymore. On top of that, high blood pressure affects anywhere that has small blood vessels. So high blood pressure will affect your kidneys. You can have kidney failure from it. One of the things I see all the time, high blood pressure affects erections. So you can have erectile dysfunction, and it can affect your brain. We talk about stroke, but you can also have different types of dementia and different types of different brain pathologies that are associated with high blood pressure. There's really not any part of your body that's not affected. It's just when they call it silent, because you could be doing damage for years before you not find out that you've caused that damage, and you may find out that by the time you are made aware of it, it's irreversible.
There's someone I know that has a heart situation, and they put something in the heart. Is it a machine or something? And now she cannot fly. A pacemaker, and so can't fly with the pacemaker.
Yeah, is that it has metal in there, so you may not want to go through. You may not want to go through like an MRI or different types of X-rays. It may show up, but no, you can still fly. A pacemaker it makes your heart beat, so it tells your heart to beat, because you've damaged your heart or there's been a genetic defect and your heart doesn't want to beat on its own. So a pacemaker will keep it beating on its own and keep it beating regularly. Right. But you can fly with them. It's just that you have to take certain precautions and let people know that you have a pacemaker inside.
Okay. That's just like a lot of work for something that could have been avoided from the beginning, Abby.
That should be the lesson of the day.
So to that point, how often should we check our blood pressure, whether old or whether young or whether middle age? How often should we check it?
Yeah, if you're, I tell people at least once a year. And if you're hypertensive, then you should be checking it at least once a month. Simple.
Did you say at least once a year?
Well, yeah, you should be checking your blood pressure at any age, at least once a year. So if I'm 18, 19, 20, 21, you should check your blood pressure at least once a year. A lot of people don't check blood pressure until they're in their 40s, or they have a problem, or until they get to the hospital, right? And that's why we have so much undiagnosed hypertension. But once a year. Now, if you now find that you have high blood pressure and you're on treatment, medicate at least once a month. I check my blood pressure every day. Every day.
That's why I raise my eyebrow.
Oh no, I check it every day, and I tell my patients to check it every day. I'm just giving you the textbook guidelines, but there's nothing wrong with checking it every day. I carry my blood pressure machine in my bag everywhere I go.
So the reason why I raised my eyebrows was because I was like, what do you mean once a year? Because anything can happen within a year. You could be 39 or you could be 25, and then at 25 and a half or 25 and 3/4, they say, oh, sorry, you have high blood pressure because something had gone wrong. So follow Dr. Abiola's advice, not the textbook one. Check your blood pressure if you can every day, because if you go to the hospital, they check your blood pressure.
Mm-hmm.
So if you went
every patient that walks through the door, we check blood pressure every time. It's important. Very, very, very important. One of the simplest things you can do to extend your life.
Checking your blood pressure. Okay. We've talked about lifestyle changes. We've talked about diet. We've talked about exercise. What about sleep? In a country like ours, or let me use Lagos as an example, maybe not other states. In Lagos, for example, where you're awake before 5 and you're asleep by like 10 because you spend more time on the road. So if you say you do a 9 to 5, it's not really a 9 to 5, it's a 5 to 9 because you wake up by 5 and then you come back, you're probably home by 9. you're unable, and then by 9 you want to do one thing or the other, you're unable to get 8 hours. Maybe it's 8 hours of sleep that is recommended. What can we do about sleep?
Yeah, sleep is one of the most underestimated tools that we have. If you sleep in less than 6 hours a day, your risk of high blood pressure increases by 40%, almost 50%. And it increases your risk of stroke almost three times, just sleeping less than 6 hours a day. In busy cities like Lagos, many adults sleep like 4 to 5 hours because of everything you mentioned, work, traffic, or nightlife. That alone can drive your blood pressure up. When I mentioned earlier that exercise or movement is free medicine, sleep is also free medicine. If you can sleep 7 to 8 hours, you can drop your blood pressure by 20%. This is something we call nocturnal dipping. And if you don't get good sleep, then you don't get that effect. So your BP stays high for 24 more hours. You have high cortisol. Cortisol is a stress hormone. You have high insulin. Both of those lead to weight gain, which just perpetuates the problem. So you now end up in the cycle that keeps going. Poor sleep, high cortisol, high insulin, weight gain, and then that keeps compounding itself until, if without intervention, you have a stroke or a heart attack, or you die in your sleep.
Not to be shady or anything, we hear a lot of people, entrepreneurs, successful people say, oh no, why are you sleeping as a young person? You're supposed to be using your time to da, da, da. What do you say to that? Because I think that also puts immense pressure on young people. Oh, I'm not supposed to be sleeping 6 hours. My mates are not sleeping. Yeah. Because you have people that come out to say they sleep 3 hours a day. And I'm just like, that is a faulty message. What would you say to that?
Yeah, that message is rubbish and nonsense. For your brain to form long-term memories, you need sleep. So a lot of those memories are done in your sleep. For your immune system to repair your body, repair damage in the brain, repair damage throughout the body, it's done during sleep. So sleep is extremely important. Even if you're weight training and you're trying to improve yourself with exercise and or with weights and you're not sleeping well, you won't see the gains like you're supposed to do, because during those rest periods is when your body really repairs and builds and does all of that. Oftentimes I will call them idiots that are on social media saying I sleep only 3 hours a day. It's usually lies. They may sleep 3 hours yes, definitely, because the human body, after some time, you will see the how would I call it now? The disadvantages of sleeping that little, that your person will not be able to make complete sentences. Your body will break down. You have facial sores, all kinds of issues. So sleep is extremely, extremely important.
Okay. Finally, Dr. Abiola, thank you so much for coming. What is the key message you would like our listeners to take away about preventing hypertension and living a heart-healthy life?
High blood pressure is not a spiritual attack.
Say that again, Dr. Abiola.
High blood pressure is not a curse. It's not a spiritual attack. It is not destiny. It's largely preventable with lifestyle and diet, and it's definitely manageable with many different things. So check your numbers, eat natural food, move daily, and sleep well. You don't have to work just by doing that. High blood pressure will whisper for years, and when it shouts at you, you will know.
Before you go, Dr. Abiola, is hypertension? Is it not genetic? Can it be passed down?
Yeah, it has a genetic component. So if you have, a first-degree relative, your mom, dad, and that have high blood pressure, you're 50% more likely to have high blood pressure.
What did I do? I'm innocent.
Do you get? So I always look at my dad. Like, my dad's really smart, so I'm like, hey, I inherited your brain, but I also inherited your high blood pressure risk and all of those things, which I just deal with. I'm happy to have the brain I use every day.
Yeah, and you're able to manage it anyway. So
yeah, exactly.
Exactly. Okay. Thank you so much, Dr. Abiola, for coming on the show today. We truly appreciate you. Dr. Abiola is the MD CEO of ROA Specialist Hospital, and he came on today to talk to us about understanding hypertension and lifestyle risk factors. You can get through to Dr. Abiola by their website, www.roahospital.com, or by calling 0913-579-5108 or 080-888-62635. You can reach out to Dr. Abiola on their social media pages, ROA Specialist Hospital on Facebook and Instagram, and ROA Hospital on YouTube and Twitter. Once again, Dr. Abiola, thank you so much for today's edition of Radio Doctor. Catch you same time next.
Don't forget to check your BP.
Thank you for reminding me. I'll check it out. All right. With that being said, we still have amazing shows for you on Women Radio 91.7. Today kicks off our Valentine's special by 4 p.m. with the follow-up. So you want to stick around for that. We have different guests coming in to talk about love, all things love. Enjoy the rest of your weekend and stick around with Women Radio. We got you. Many thanks to the producer, Aisha Sani. Many thanks to Benjamin in the studio and to our executive producer, Tom Okiwale Shonaya. My name is Fumi Bangala once again. This is a Women Radio, Radio Doctor on Women Radio. Do have a heart health